And hi there, I'm Janelle Marie. Welcome to Body Beautiful. This is the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking about a bunch of topics. We got breast lifts, breast reductions, arm lifts, and finally, mini tummy tucks. Remember, before we get started, any advice we give you today, consult your own physician. Let's jump right in. Dr. Mealy, thank you again for joining me.
So nice to be here. Thanks for having me.
It's always so nice to have you. Let's talk about breast lifts.
Okay.
Who's a good candidate for a breast lift?
Well, there's lots of different lifts, and there's two main reasons why we do breast lifts.
Okay.
One is to lift the breast itself, the breast mound.
Right.
The other is to sort of reposition the nipple up higher on the breast.
So why would you have to do that?
Just the nipple's all the way pointing south.
Okay.
Usually people
gotcha.
don't find it as attractive, so usually it's apparent. But the ptosis, the amount of sagging that we get, an easy way to check whether someone sort of by the book needs a breast lift is if you put your hand behind the breast and put the fingertips at the fold and sort of come straight forwards from there. If the nipple's above that, probably don't need a lift.
All right, so how do you perform one?
There's different types. So the smallest lifts are kind of right around the areola. We call those peri-areolar lifts.
Okay.
And that'll let us move 1 or 2 centimeters, just about an inch.
Okay.
For when we need to lift things higher, then we do a vertical lift. So it has a scar that looks like a lollipop.
Is that the T-scar that they call it?
Not
T-scar?
quite.
No.
No, the T-scar.
What's the difference between those?
So it would be like the T-scar except without the
without the
incision
bottom
under
part?
the breast. Yeah.
So you only do the...
Just the vertical. Yeah, so that's a vertical lift.
Okay, all right.
Or vertical mastopexy is the other word for it. And then the T-scar is kind of the one that we can do the most with.
Yeah.
So no matter what shape, where the nipple is, we can fix it with that incision.
Do you still have to do the T-scars? Or is there any other way now to fix scars so you don't have to do the T? Or that's just...
It's really dependent on the type of lift.
Okay.
If there's a lot of tissue below that fold,
Yeah.
I think the T-scar still gives us a better result. And really that incision underneath is usually not the one that bothers folks the most. It's the one out in front that we can see more. Even that vertical scar, sometimes that's the one that's the most noticeable. There are some
But they do fade.
They do fade.
Okay.
But there are some times when it's the nipple's so low,
Yeah.
I can actually eliminate the vertical scar and just use the horizontal one and the peri-areolar one. Oh. And that seems to make people really happier.
Let's go
because we don't see that vertical scar out in front.
Let's take a look at some pics, before and after pics. Here we go. First one, what's going on?
So this is someone who had some ptosis, a little bit of sagging. You can see the left side was a little bit lower than the right. A lot of times we can improve that. And I never tell people I can make it perfect, but we're trying.
Now, do you always have to put an implant in, or this is...
No.
No, okay.
I will put an implant in for 2 reasons. One is if someone just wants their breast bigger.
Oh, okay.
So if you're wearing a bra and everything's held up and the size is good, probably
don't need the
an
lift.
Implant.
You just need...
Just the lift.
Oh, okay, you just need the lift. Gotcha.
If someone has no fullness at the upper part of their breast, then sometimes we'll use kind of a smaller, flatter implant just to balance out the upper and lower pull.
Pic number 2.
So this is a side view, same idea. You can kind of see a lot of breast tissue hanging below the fold.
Very natural.
On the right side is after. And you can see the nipple's much higher on the breast,
looks really
and there's
good.
less breast tissue kind of hanging down.
So all you did there was a
no
lift.
Implant.
Did you do any fat graft or anything?
Nope, no implant, just straightforward lift.
Do you do fat grafting on breast lifts if there's a loss of volume?
I do, but I'm still a little worried about using a lot of fat in the breast. So I tend to use it more for spot problems. So if it's like someone has a biopsy and they have a divot.
Right. Oh, you can fix that?
Is the only thing that'll
fill
fix
that right in?
Yeah.
Like a pothole. All right, here we go, number 3.
Everything's kind of pancaked and collapsed and flat and just like a deflated balloon.
Yeah.
And sometimes the skin doesn't cooperate.
Yeah.
So essentially what a lift is doing is getting rid of that extra skin, tightening it up, and just changing the shape.
So you don't need an implant. It looks very natural. It's actually
and it's
very
a lot
nice.
tighter too, so when you're moving, it doesn't move as much.
Let's go to our last picture. And what's a recovery period?
So,
wow.
So this is someone where I did use an implant.
Oh, you did
I
use an implant on that one. Okay.
Because if I just done a lift, she would have been still like a double A cup. And her goal was not to be that. She wanted to be more of a full C.
And I can't see I kind of see the scar a little bit, but you can't really see the scar underneath.
You can kind of see it.
Yeah, but not too bad.
It runs up and down and around
and
the
then
areola.
they fade away. That's a very nice result there. What's the recovery time for breast lifts?
So breast lifts alone, usually recovery is pretty quick. Since there's no implant in there, we're not stretching the muscle underneath. It tends to be more of a skin incision, which after a few weeks, people are actually doing everything they want to do. And I'd say a lot of folks, the problem with breast lifts is I'm trying to slow them down a little bit because they're not having that negative feedback of pain to slow them down.
Do you have to do general anesthesia?
Often, usually.
Is that right? Anesthesia?
Usually I would do general anesthesia for these because not so much that I couldn't do it under local, it's just a long enough procedure.
Yeah.
It's better just to get some medicine and then be done.
All right, sounds good. We've got lots more to talk about. For more information about Dr. Mealy, you can call 925-943-6353 or check him out on the web at either drmealy.com or sanfranciscobreast.com. Lots more coming up on Body Beautiful. What are we talking about next?
Breast reductions.
Don't tell them.
Breast
Oh, that's right, breast
reductions.
reductions. We'll be right back on Body Beautiful. Stay right there.
Always.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.